In this 10-minute video, I'm going to talk about a meeting I had a couple of days ago with a specialist of proton beam therapy. Proton beam therapy is a type of radiation treatment. So currently there are 3 pillars of cancer treatment: surgery, chemotherapy, and radiation. All 3 pillars are terrible, really. Yeah, maybe that's a subject for another video. And I have had surgery. I had major surgery last year. 25% of my colon taken out. You have 1.5 meters of colon, I think, and about 15 meters of small intestine, but still 25 centimeters of my colon removed. And I've had chemotherapy 27 times. I've not had radiation treatment, but I do have other treatments, 2 types of immunotherapy, a drug treatment to change the tumor microenvironment to allow the immunotherapy to work better. I have hypothermia treatment, which uses radio waves to, I don't know, could you even call that type of radiation treatment? It's non-ionizing, but anyway, using radio waves to heat you up. And I have molecular targeted therapy, a drug called Avastin, which attacks the cancer cells and prevents your body growing new blood supplies, which cancer cells desperately need, cancer tumours need. So I'm currently having 6 treatments for cancer, and I was suggested to me by my immunotherapist that it might be worth meeting the proton beam specialist. So I made an appointment to see him. He comes to the clinic I go to. He comes there a couple of times a month. So I made an appointment to see him, which was for a couple of days ago. But a couple of days before that, I had my regular appointment at the public hospital for chemotherapy. I have 3 days of chemotherapy twice a month. And when I have it, I meet my oncologist. So I go to the hospital, I have a blood test, and the oncologist looks at the blood test results and talks to me and sees if I'm healthy enough to have chemotherapy. I've had that 27 times so far. Anyway, I talked to my oncologist about the radiation treatment. I said I was going to meet with a proton beam specialist, and I asked what kind of questions I should ask my proton beam specialist. And I got some good questions. My oncologist was very concerned at the idea of me having radiation treatment because usually you have to stop the chemotherapy. Radiation treatment can cause tumours to bleed. That's a very bad idea for someone like me who's having Avastin, which makes healing from bleeding very, very difficult and slow. Radiation treatment can also cause bowel perforation as a side effect, where you basically get holes in your colon and in small intestine. Not good stuff. So I had quite a few concerns, and to be honest, after doing some research online, not getting a lot of clear information, but just feeling like I probably wouldn't go forward with proton beam therapy if it was a possibility for me. But talking to the proton beam specialist, Dr. Murakami, it kind of changed my thinking a lot. I had heard proton beam therapy was a very gentle therapy. I was very skeptical about that because gentle and cancer treatment are not things that go well together, although my immunotherapy is as gentle as anything could possibly be. But I asked the specialist about risk of tumour bleeding, a risk of bowel perforation, having to stop chemotherapy, having to stop Avastin. And he said that in the specific case of a proton beam therapy, those things just really don't apply. I will continue my treatment as usual if I am able to have this proton beam therapy. I would just continue my complete normal schedule of chemotherapy every 2 weeks with Avastin. And the proton beam therapy, if I can have it, will take 2 months. Sounds crazy, but it's a 3-minute blast of radiation. It's a 15-minute session with kind of positioning you on the bed and running some tests or whatever. But essentially, they're 15 minutes. But you can only do it once a day, Monday to Friday. So for 37 treatments, it's the 7.5 weeks. But during that time, I'd be doing my chemotherapy and my Avastin as usual. And hopefully, the proton beam therapy would destroy the tumours in my liver, of which there are 3, although possibly one of the smaller ones is actually not cancerous anymore. On the CT scan, it looks like it's essentially scar tissue. Very hard to tell on a CT scan, but that's what it looks like. That will be checked out on Tuesday next week when I have a PET scan, which is one of those scans that can show if cancer is active or not. And then on the Wednesday, I'll have an MRI scan of my liver. And Wednesday, late afternoon, early evening, or whatever, meet the specialist again. So this will all be in northern Japan, in Fukushima, where the terrible triple disaster of the earthquake, tsunami, and nuclear meltdown happened. And maybe possible for me to have proton beam therapy. And I hate to use the word cure in the context of terminal cancer, but there's a chance. There's a chance that it would be done with what's called curative intent. Just incredible that there's even a tiny possibility of curing terminal cancer that's basically going to kill me. And if I'm able to have the treatment and it's not a cure, then still it's potentially talking about extending my life not by 3, 4, 5 months, but by 2 years or more. It just is unreal that this is kind of even a possibility. It's a very expensive treatment. It's 3 million yen just for the actual clinical bit of it. So 3 million yen plus expenses. I'd have to stay in northern Japan for 2 months, basically. But I'm trying not to get too excited about it. I may just be told on Wednesday it's not even a possibility as a result of the scans. But the fact that these kind of treatments are out there is amazing. I'll do another video soon about how proton beam therapy works and why it's potentially a good treatment. But thank you so much for listening. My fundraising link is www.matthewdons.org, and please subscribe to this video. It makes a huge difference because when you subscribe, YouTube shows the video to more people, and more people get to see my videos instead of the nonsense, lies and misinformation that bad and or maybe stupid people put on YouTube about cancer. Thank you so much for listening, and thank you for your support.